Hi, my name is Andrew Schwab, and I'm a study director in the Discovery and Translational Sciences team here at Metabolon. So in this case, I'm going to give you an example of how metabolomics was utilized to identify a preclinical marker of acute renal injury. So in this biomarker case study, a metabolite was identified as a marker of renal toxicity with off-target safety implications. The client had compounds that were being developed for treatment of dyslipidemia. Unfortunately, one of their compounds caused rapid onset morbidity and acute renal failure in mice. And this acute renal failure was unrelated to the mode of action based on knockout data provided by the client. So for this study, mouse plasma and urine were analyzed across a range of compound doses. The metabolomic results identified 3-indoxyl sulfate as a sensitive marker for renal failure. Interestingly, the 3-indoxyl sulfate is derived from microbial action in the gut. 3-indoxyl sulfate is a known renal toxin that accumulates in blood of uremic animals or in patients with chronic renal failure. Mechanistically, 3-indoxyl sulfate is thought to promote renal failure by damaging tubular cells through modulation of OAT1 and OAT3 transporters, which are expressed on the basolateral membrane of the proximal and distal tubules. So in this figure, you can clearly see that indoxyl 3-sulfate is a more sensitive marker than other established renal response markers, including creatinine, urea, and p-cressyl sulfate. So next, the client used this data to develop a targeted assay to screen this compound along with other backup compounds. And this resulted in the identification of different compounds directed against the same target that did not cause renal toxicity. So in conclusion, the metabolomics data revealed high levels of indoxyl sulfate with acute renal failure. The validity of this marker was supported by 3-indoxyl sulfate's known role as a uremic toxin in humans. Most importantly, the findings revealed a practical path forward in the development of a targeted assay that was used to screen backup compounds. And finally, this example clearly illustrates that metabolomics is a powerful tool that can deliver actionable insights for toxicity assessment.